É o XRL do Beard.
For joining back in with us right now, we have Dr. Moore and Ann from Duke University, and they're just going to be telling us who they are, what they do, and if you guys have questions, throw them in. If not, I'll fill the void. So go ahead and introduce yourselves.
Great. We're very excited to be here. This is our first time on Twitch. I'm Dr. Moore. I'm one of the HD specialists at Duke, and I'm really privileged to be a part of an amazing group of providers at Duke that help every week to take care of people and families with HD. And part of that is Ann, who's from our social work team.
Yep. Dr. Moore said it. My name's Ann Kosem. I'm a clinical social worker in the Movement Disorders Clinic at Duke, and specifically work as a clinical social worker and a center coordinator for HDSA. We're a center of excellence in North Carolina. So happy to be here. Thanks for having us.
Oh yes, it's wonderful to have y'all. So my big question for you guys to start off with is, what got you in the field of HD?
Well, I've always been interested in the brain and neuroscience and neurology, and was really privileged to train as a neurologist and then as a movement disorder physician. And as part of that training, I was first introduced to the practice of care in HD. I think most doctors will read a paragraph at some point. This is HD, and it's on this chromosome, etc. But it's not really till you meet people that you can start to understand what goes on in this disease, either for the individual with HD, people at risk, people in the family that are a part of their care team. And I just found people with HD so inspiring and resilient, and it's been a joy to take care of them and make this a part of my practice. So to me, it's been a wonderful journey of learning how best I can serve the community.
Yeah. So I've been at Duke 26 years and had been working for the first 20 in oncology. And I worked for, a lot of that was in pediatrics, and so I worked with a lot of the parents. And so my shift actually was just sort of random. I had an opportunity to take a new position within Duke in the Movement Disorders Clinic, so I didn't really know that much about Huntington's. I actually, earlier in my practice, I had helped a family who the father had HD, and I took care of their child and the family who was dealing with treatment. But fast forward, ended up in this role at Duke and have stumbled upon it, but love it. I have really enjoyed the opportunity to serve families, providing care to care partners, helping them navigate the medical system, helping them navigate a new diagnosis or diagnosis of a loved one. And that's really my love, is taking care of people who are sort of trying to navigate their way through the big, scary health system sometimes. Yeah.
So, and you did mention that Duke is a center of excellence. Could you guys touch base on how you qualify and what it means to be a center of excellence?
Sure. We can. HDSA has an opportunity to receive grant money for designated centers of excellence, and they have criteria, and we have a center director, which is Dr. Scott, and then Allison and I co-share the role as a center coordinator, and really we're tasked with being available to educate and provide services to the whole state. Which, we certainly help our patients at Duke, but our support groups, our programming, the things we do, just even the support and care, we help anybody who calls us. As we know with HD, there's plenty of people who aren't tied in to a big medical center, who might be from rural parts, and they may call and ask questions and want to learn more about HD or the testing process, or how to care for their loved ones. So we just make ourselves accessible to anybody. Yeah.
I would just add, on the clinical side, as a center of excellence, we're honored to have a big team that's part of what we do for care, and so that includes, on a weekly basis, physical therapy, occupational therapy, speech therapy, pharmacy, wonderful social work team, and the chaplain. And so they're there for patients who come and see the doctors. Hey, all these people are available to you to make sure we have comprehensive care. And so we are able to offer those services as well as access to clinical trials. And so it's really a one-stop shop kind of thing for all the things that you need. It's a long visit, as you can imagine, trying to do all those things, but the structure of the clinic allows us to take the time that an individual and a family needs to learn from all of those people, but also for us to collaborate, right? So if Anne comes back in the room and says, hey, Dr. Moore, I'm worried about this person's XYZ, what do you think? Let's get somebody from OT in there to see him about this specific issue. And so it really helps streamline and optimize care.
And I would say it helps us to look at the person as a whole person and look at from everybody's looking at them through their own lens, and then we can come together and figure out how to best care for this patient so they're getting the best care.
Really, the best care is when your medical team is talking about you, and we're able to do that on a weekly basis.
So I'm glad you stated clinical trials. So what clinical trials is Duke offering at the moment?
Right now, we are only enrolling in Enroll HD, but we are hoping to roll out some additional studies in the near future. And until we do that, there's rules around what we can share that's going to be available.
Right.
But Enroll HD is a great way for anybody who is at risk or early in their HD journey to, number one, continue to get comprehensive care. And that allows us to collect a bunch of data. There's over 30,000 people worldwide enrolled in this study. It's observational, so it's not getting an experimental medication. But it's so that we, as the HD research community, can learn as much as we can about folks. And there are many publications out of that data set. I think also it helps us understand how best to design the clinical trials. So if you're part of that study, you're helping to make the future of clinical trials better.
So, I do Enroll HD. I do mine through University of Iowa, and I've been doing a lot of the clinical trial side of things since 2007, 2008.
That's great.
Give or take. And what I love about Center of Excellences, especially Duke, Mackenzie Luxmore, I've had a lot of time with her. You guys are some of the most communicative people that I've met, and you always give the best information, and you guys truly care about who you take care of and who, anyone who comes to the door. What is one message that you want to give to people who are kind of sitting on the edge of whether or not to, start their HD journey?
Well, first, I appreciate you saying that. It's very kind and certainly something that we strive for. By being focused and concentrated in that space as a team, we're able to amplify each other in how we help care for folks. Man, there's a lot of things I would say to those of you out there considering coming to a center of excellence, considering testing. First of all, it has to be the right thing for you, but you can certainly come in and talk to us and say, is this the right thing? What are the things that I should be thinking about and planning? And at least for me, just to know that if you come to the clinic, it doesn't mean that you're ready to test. It doesn't mean that you're ready to start medication. We are a point of contact of information, of care. And we always make it clear, if I do your physical exam, do you want me to tell you what I'm seeing? That's your right to say, I don't want to know if you're seeing symptoms too. So we're here along the whole journey to give you the support that you need. So that's a good place to be thinking, we're a resource point, not necessarily that you have to wait until you feel like you've got everything figured out.
Yeah, so much of what we do as a Center of Excellence is provide education. And so we want people to have the information they need so they can make the best decision for themselves. And we don't have an opinion we don't know what's best only the person going through it can decide what's best for them, but they need all the information. So it's an educated decision about, what they're signing up to learn. And so having Allison and I tend to we get a lot of initial calls of people who just, hey, I have HD in my family. I kind of didn't want to get tested, but now I'm sort of thinking about it and I just want to know what's involved. So there's no commitment, just to get education, and we can tell them what's involved or answer questions or tell them what the process is. And so there's steps before even coming to clinic. But even like Dr. Moore said, when you come to clinic, there's no pressure or stress around. We just want you to, you come with the agenda. What do you want? What do you need? How can we help you in this process?
So, last question. We are a gaming group, so I do have to ask you a gaming question.
Oh, no.
Oh, boy.
If you could only play one game for the rest of your life, what would it be?
This is gonna date me, but Frogger.
Oh, no, Frogger's amazing. I cannot blame you on that one at all.
Yeah, that was always my favorite. Still is my favorite. I still refer to Frogger when I go to cross the street. I'm like, I feel like this is gonna be a Frogger situation.
Oh gosh, unlike my husband, I'm not really a video game sort of person.
Oh,
at
board games are
all.
good. I play Magic the Gathering, which is a card game.
Yes.
So.
I'm just saying the thing that I enjoy most is Trouble, but that's because my nieces and I can make that popping sound and it drives my parents crazy. But maybe that says more about me than the
Hey,
game.
causing trouble, that's always fun.
Yeah, exactly.
My mom and I, we always played Scrabble.
There you go.
Oh,
It's a
she
good
was an
one.
English teacher, so
Oh,
it took me a while to actually win a game.
I'm sure. Yeah.
I gotta tell you, Scrabble is really, really good for preserving cognition.
Mm-hmm.
It
Yes.
really is. Like, because you expand your mind with having to think about new words and making up words and finding all the words. And so whenever we do sort of some cognitive testing with folks, the people who usually rock it, those people, I'm like, do you play Scrabble? And they're like, yes, I do. And that's, so
Pro tip
there's
for
benefits,
fans.
side benefits to playing Scrabble.
My mom and I played Scrabble all up until right before she passed, and it was just like, I saw a picture of her last game, and she got mad at me because I made 3 8-letter words, and she's like, that's not fair.
That's impressive is what that is. That's great.
Well, thank you so much for being on here.
Thanks for having us.
Thanks, everybody.